So I've already set up my aseptic field. I have taken off the bandage. I will now doff, sanitize, and don with a clean pair of gloves. And then now, Mr. Hardy, I'm going to be speaking with my CI about your wound, and we're going to be taking some measurements, so just hang tight for me, okay? So now if we look at this wound, it's located on the distal left lower extremity leg. It's located on the medial aspect, just superior to the medial malleolus. If we go and we look at the wound, that it's a full thickness wound. It shows about 95% viable tissue and about 5% slough. Next, we're going to be looking at the peri wound. So we can notice here we have some hemosiderin staining, which is this dark red, almost purple looking color. That is a sign of venous insufficiency as well. He also has some maceration. It's this white, kind of shiny area over here. It just looks like it's a little bit, the skin has more moisture in it. Now we are going to orient our clock. So for this person, we are going to have 12 o'clock be towards the body, which would be the superior aspect. 6 o'clock will be down here. And then we are going to have 3 o'clock on the most anterior side, and then our 9 o'clock on the most posterior side. Now we're going to go ahead and look at our edges. So the wound edges appear to be rolled about on the superior aspect towards like 11 o'clock, and then on the distal anterior aspect around 5 o'clock. We'd be able to get a more accurate description of that whenever we're in person. And next we are going to be taking some wound measurements. So for the length, I'm going to be taking it from 12 o'clock to 6 o'clock. And I'm going to edge. It appears to be about 2.1 centimeters, so I would go ahead and document that. Now we are going to be taking the width, and so this is from 3 o'clock to 6 o'clock, 3 o'clock to 9 o'clock. And it looks to be about 2.2 centimeters. And then now that this has touched the wound, we will be putting it into our trash. Next, we're going to be evaluating the wound base. To do that, we'll use a cotton tip applicator. We're going to be probing perpendicular to the wound, and we are expecting to find a springy end feel. Whenever we find the deepest point of the wound, we are going to slide our thumb down till our thumb is at base level with the skin around it, and then we would take a measuring tool and measure that up to the length of our fingernail of our thumb, and then you would throw those away as well. The next one we are going to do is check for edema. So to do that, we would get another cotton tip applicator for our tunneling and swelling. Okay, no, we can keep going, keep going. I'm just gonna edit it.
Yes, keep going.
Oh shit, sorry. And then the next one we're gonna do with the new cotton tip applicators, we're gonna try to be feeling for tunneling or undermining. So to do this, we're gonna be sliding the cotton tip applicator underneath the skin and seeing if there's any points that we can go underneath. So if we would be able to, so say if there's a tunnel right here at 11 o'clock, we would document that there's a tunnel at 11 o'clock, and with tunnels, you would not be able to move side to side. But say if we have undermining here at around 2 o'clock, I would go in and I'd be able to move my cotton tip applicator side to side. So with that, I would want to document where the undermining begins and where the ends of it are, and I would use the clock for that. Next, we're going to be looking at our wound base. So with this, we can see that it's, again, about 95% viable granulation tissue. It is a nice red, kind of a moist color, so we can tell that there's blood flow. This 5% over here is slough. It just looks like white. That would be our non-viable tissue. The tissue appears to be blanchable, so what we want is we want to be able to put our finger on it and apply some pressure, and the tissue turn white around it. And then whenever we take our finger off, we want the capillary refill to be less than 3 seconds. So after examining this wound, I'm thinking it's a venous insufficiency wound. He has the hemosiderin staining. He has a positive venous insufficiency time, which was less than 5 seconds. He also has a history of HDL and hypertension. He does have edema, even though it's non-pitting, and he did start a new job where he stands up all day, so he doesn't have the natural calf pump action. He also describes the pain as throbbing, which is indicative of venous pain. He has a negative ABI, no score on the wells, so we're not expecting of a DVT, and all his sensations are intact. So we are expecting venous insufficiency.